Today we are celebrating the World Hypertension Day, and I am Professor of Cardiology and Head of Department at D.Y. Patil Medical College, Navi Mumbai, and also a consultant cardiologist at Hinduja and Rich Candy Hospital, Mumbai. I have a few things to say about hypertension. One thing is why BP is important, because if you have a sudden rise of BP beyond 180 and 110 diastolic, then you can get either a bleeding in the brain with a stroke, or you can get heart failure. And the other way around, chronic long-standing uncontrolled blood pressure can cause brain stroke, it can cause heart failure, heart attacks, kidney failure. So blood pressure is a very dangerous thing if it is not controlled. But the best part of it is, if it is well controlled, then most of these complications are almost always preventable. That is the importance of a good control for blood pressure. Now, there are certain misconceptions among public about blood pressure. The misconception number one, I would say, is people feel that if they don't have any complaints, even if the blood pressure is high, they did not take treatment. This is absolutely wrong, because the blood pressure is always called as a silent killer in medical terminology, and it silently carries on its effect without the person knowing that it is causing him harm. So when you have headache, then you find your blood pressure high. It is also always possible that when you don't have headache also, your blood pressure can remain high, and that is why it causes all the damage. So the most important thing is control your blood pressure, whether you have a complaint or you don't have a complaint. The second misconception which people have is that it is difficult to control their blood pressure. Many patients come to me saying that so many things doctors have tried. So if your family physician is finding it difficult to control your blood pressure, you always need to see a specialist, because today so many medications are available and it is almost impossible that you cannot control your blood pressure. It is always possible to control it. And if you have a regular diet, reduce your salt intake in your diet, do a regular exercise, get your weight down, and take some medications as advised by your expert doctor, it is always possible that blood pressure can be controlled. The third misconception that people have is that they have to always go to a doctor to measure their blood pressure, and the home blood pressure equipment which is available is no good to measure the blood pressure. This is absolutely wrong according to me. The home blood pressure equipment is absolutely good. However, this equipment requires frequent calibration. What does that mean? Whenever you go to your regular doctor, you always go with that equipment to the doctor, and when he checks with his equipment, you ask him, please check my home BP equipment, and then you will immediately know whether there is any difference of blood pressure being shown, and then you can adjust accordingly. Because blood pressure requires to be frequently checked to know whether it is going up or whether it is well controlled, it is always better to check it at home, in your home environment. Whenever you go to a doctor, you may have a little bit of stress and your blood pressure goes up. So falsely you can be diagnosed as high BP when you actually your blood pressure is lower. So it is now taken for granted that home environment is the best environment to check your blood pressure, and your home equipment, if it is regularly calibrated with the doctor's equipment, which is easily possible, you can use your home equipment all the time. So these are some of the simple things which I would like to stress upon, so that people don't misunderstand about their blood pressures and they suffer from the various complications of blood pressure that I have already told you right in the beginning of my talk. Have your blood pressure well checked, well controlled, and live a healthy, good life. Thank you.